Welcome back. Today we are diving into a groundbreaking new way to screen for cancer. So watch as we learn more about a simple blood test that helps detect multiple cancers in people about 50 and older.
With nearly 70% of cancers lacking recommended screenings, this innovative test could make a huge impact. Take a look.
Cancer affects so many lives, but did you know that nearly 70% of cancers have no recommended screening tests? That's why early detection is so important. Joining us today is Dr. Candace Westgate, an OBGYN, to share how a new simple blood test is helping screen for multiple cancers in people 50 and older. Thank you so much for joining us.
You're welcome. So good to be with you today.
Absolutely. Now, can you tell us about this new screening tool and why it's actually needed?
Absolutely. So currently in the landscape of cancer screening, we have 5 cancer screenings that are recommended. But as you said, 70% of cancer deaths are from cancers that do not have a screening tool. And so as providers, have to wait for our patients to come to see us with symptoms before we would start a diagnostic evaluation for that patient to determine, what the cause of their symptoms are and potentially diagnose the cancer at a much later stage. Versus with cancer screening in asymptomatic individuals, we're able to catch the cancer at a much earlier stage where treatment is available and possible.
Oh, that's incredible.
Yeah, that's great.
So is this test something that anyone can use?
Currently, the test is recommended for those individuals that are at increased risk of cancer. And that's unfortunately as simple as being over the age of 50. So age alone is an independent risk factor for cancer risk. However, I highly recommend speaking to your healthcare provider and getting a risk assessment done on your individual risk factors and where you fit in cancer risk. Are you in the general population, or you're at higher risk or significantly higher risk because of having an actual genetic mutation? This test we use in addition to all of our current cancer screening tests. So we use it in addition to, not instead of. So exciting new technology that's able to test one individual for multiple different cancers. This is really moving steps forward in regards to equity and access to cancer screenings with a simple blood test.
Yeah,
Right,
I love that.
that's incredible. So can you maybe talk about what happens after the patient takes the test?
Sure. So the blood sample is sent to the lab where it's then analyzed. The turnaround time is about 14 days, and the test results are released to the patient and the healthcare provider. A follow-up visit is recommended to discuss the test results and what the next steps might be. So 2 results that come from this test: cancer signal not detected and cancer signal detected. For those individuals that get a cancer signal not detected, it's important to make sure you're still staying on top of your other cancer screenings that are recommended, as this test is used in addition to, not instead of. And knowing too that any cancer screening test has limitations. It's not 100%. It doesn't pick up all cancers, as certain cancers are not able to be found just with a blood sample alone. And this test is recommended to be repeated on a yearly basis. It's just a screenshot in time right now of what's going on in an individual's body.
Yeah.
For those that get a cancer signal detected, this is a screening test. So the next step would be the diagnostic workup and evaluation. And again, because of this very unique cancer signal or a fingerprint that the test identifies, it's able to actually give us a signal of origin or tell us which tissue or which organ system to go and look at to see if there's cancer there.
Doctor, what questions should we ask our own doctors about taking this test?
I recommend to all my patients asking their physician about what their true cancer risk is. This way they can personalize their cancer screenings, their interventions, and determine if a new multi-cancer early detection blood test like this Galleri test is right and appropriate for them.
And where can we go for more information? Maybe we're looking for more information about this test specifically. Where should we go?
I recommend going to their website, galleri.com. That's Galleri with an I, GALLERI.com.
That's the place. Okay, thank you so much for joining us. We appreciate it.
You're welcome. Have a great day.
You too.
Yeah, you too. Man, that is a very exciting that we can kind of get those early screenings and early detection.
I know. I mean, it's amazing how far that we've come with technology now, even within the last 10 years.
Yeah.
So really encouraging to see that.
Absolutely, yes.